That September sound, back to school, is underway.
I am very excited
to see all my friends.
I'm just excited to go.
But this year, that familiar routine looks quite a bit different.
Well, it's kind of weird, actually.
My favorite mask.
From masks to distanced desks and staggered starts. The rules may vary from province to province, but the common feeling, anxiety.
None of us feel safe about going back to school. Not one person that I've talked to feels safe.
We're a bit nervous and not sure how everything will go.
Parents, students, and teachers have questions about safety in school and how COVID is changing the classroom. So tonight we are putting some of those questions to two experts. Dr. Susie Hoda is an infectious diseases specialist with Toronto's University Health Network, and Dr. Danielle Martin is a family doctor and chief medical executive at Women's College Hospital. Thank you to the two of you for joining us. Dr. Hoda, maybe we'll start with you. This is a question coming from Grace, who is a grade 10 student.
Are children and teens less likely to have experiences or symptoms with COVID-19 that would categorize them as long haulers?
Okay, so Dr. Hoda, maybe first you could explain what a long hauler is, and then you can go for the question.
Right, so I think we've all heard stories about these long haulers, and they typically are young or middle-aged adults who were previously healthy, but after recovering from COVID-19 infection, they tend to have lingering symptoms, and it can be a variety of symptoms that people experience, from fatigue and headache that go on for months, to even serious things like heart palpitations and what people have called brain fog, so difficulties really kind of sorting through things and memory problems. And we really don't know what causes those symptoms. And ultimately, we need to get a lot more research into it to understand it. When it comes to children, we don't really have a good sense of what the long-term consequences of infection are. There's a lot of discussion about how kids tend to have milder infections when they get COVID-19, or even have no symptoms at all. But what those lingering effects could be, or what might happen down the line, is really unclear at this point in time. So I think we have a need for more research into this area to understand those impacts.
Yeah, tough question to answer. And so I suppose caution is the order of the day all the same. Dr. Martin, so here's a question that came in via email. This is from Sandra, and I'll read it for you. Shouldn't school-based staff, bus drivers, and students get tested prior to the first day of school? And Dr. Martin, I mean, worth mentioning here, we put this question to a few of the biggest school boards across the country, so Toronto, Vancouver, Montreal, and not one said that it would be requiring staff to be tested before coming back. So tell me, is that a good idea?
Sure. I mean, first of all, it's not wrong to get tested, but the reality is that even in healthcare, where we have much higher risk of exposure to the virus, hospitals and other organizations are not requiring that all staff get tested. Remember that if you get tested before the first day of school, all that really tells you is that you don't have a positive test on the first day of school. And we know that when you're testing large numbers of people who don't have symptoms, those tests are not always totally reliable at the population level. So the most important thing, I mean, if we were going to do that, we would be having to test everybody all the time at a very high frequency in order to give us useful information. Otherwise, it's just a single data point at one moment in time. The best thing that we should be doing, the most important thing that we should be doing is if you have any symptoms at all, you shouldn't go to school and you should be tested. And that applies to you if you work in a school or if you're a student at a school. Those are the people we need to really focus on testing.
Right, and I know a lot of people, they might be surprised to hear what you just said, that even in a hospital setting, it's certainly not the norm that every nurse, every doctor, every staff member gets tested every day, for example, when they come in. Dr. Hoda, that's your experience as well?
Absolutely, and I agree with everything that Dr. Martin's mentioned. Testing, the other downside to it is if you test people and they come up negative, I think, sometimes they get a sense of security from that can be false and misleading. And they can change behaviors in terms of what they need to do to prevent infection transmission. And so that's one of the downsides, too, that I caution people to.
Okay, Dr. Hoda, we'll have you take this next question. This is from a teacher in Toronto.
Our classrooms have pretty poor ventilation and some pretty small windows. So I was wondering if it would be worth it to get a couple of those window fans to draw some of the air in and out, if that will help mitigate the contraction of COVID-19, or would that make things even worse?
What do you think?
Yeah, it's a great question. I mean, we know that ventilation is really important for infection prevention with COVID-19. And fans seem like a good solution when you're not really sure about the ventilation in your school. And, many schools were built quite a long time ago, and maybe not to the kind of standard that we would accept today. So it is an issue. The problem with fans is that they tend to disperse particles, and that could include virus that might be in the environment in pretty erratic and unpredictable ways. And so they can actually paradoxically increase your risk of getting exposed to the virus if it happens to be floating around in the environment. So I wouldn't really think that's a good solution to the problem. I think what's more important is for schools to be looking at their ventilation systems and trying to make sure that they're well maintained and working as best as possible. And looking towards the other prevention measures that we have in place, like physically distancing people and masking, to complement that and make it as safe as possible environment.
Now, speaking of masks, no surprise we're getting lots of questions about those, especially since a lot of kids will have to be wearing one on the school premises. So here's a question from these two grade 2 students.
Do we need to wear masks during school? And if we need masks, do we need to switch it a few times during school? And when we're eating, how are we going to eat with our masks on?
All very good questions. Dr. Martin, why don't you take them on?
Sure. I mean, the first answer is yes, it is a very good idea to wear a mask when you're in school. And if you're going to be playing close to friends in the schoolyard, you should also be wearing a mask even in the schoolyard. But certainly in the classroom and in the hallway, you should wear a mask all the time. And you can practice wearing a mask at home. This is one of the ways that parents can help their kids to prepare for back to school, is practice how to wash your hands, how to put the mask on by touching the elastics, how to wear it so that it fully covers your nose and your mouth and your chin, and then how to take it off when it's time to eat. Don't try eating with the mask on, because that won't work. And the most important thing when taking off a mask to eat is to find a clean place to put it down. And when you put it down or when you put your mask back on, not to touch the outside of the mask, because that's the part that is exposed to the outside environment. And so parents can really work with kids to help them to practice and teach those skills. You wash your hands before you put it on. You wash your hands after you take it off. And you can wear the same mask all day long as it's not dirty or wet. But it's also a good idea to have an extra mask in your backpack all the time, just in case you lose or break your mask or it gets wet or dirty in some way.
This year I'm going to grade 3. I was wondering if I could share my school supplies when we go back to school.
Contaminated pencils, erasers. Dr. Hoda, what do you think?
Yeah, so I think we've learned over time that surface-based transmission for COVID-19 seems to be less of a factor, and really it's the respiratory route of transmission that's most important. The virus doesn't tend to last on most materials or surfaces for longer than hours or days. But that said, if you've got items that are, really frequently handled by lots of different people, it could pose a risk. And so, first of all, it's really important to reiterate hand hygiene and cleaning hands very frequently in schools. But it's also why we not recommend that kids actually share their school supplies. If they have to share something, then disinfecting them between uses is important.
Okay, sounds good. Dr. Martin, so with cold and flu season around the corner, we've been getting lots of questions like this one. Take a listen.
If a kid in school is sick and our kid was in contact, does only our child have to isolate, or does our entire household have to?
That's a toughie.
Boy, it's confusing, right? So as a general rule, when it comes to infectious disease and public health, we worry a lot about direct contacts. We worry a lot less about contacts of contacts. So in this case, if my kid goes to school and then comes home and has a fever or a cough and tests positive for COVID, then she would have to self-isolate, and so would everyone in our household. But if she comes home from school and someone else in the school has tested positive and she feels well, she may be asked not to come back to school for 14 days, but in all likelihood, I will be fine to continue to come to work. The bottom line is that every situation is going to be different, and so you're going to get clear advice from public health and from your school if that situation arises. But as a general rule of thumb, think about direct contacts and worry less about contacts of contacts.
Should those contacts of contacts get tested themselves, or is even that not really necessary?
I think that's going to be a case-by-case decision is the short answer.
Right.
But in most parts of the country, I think tests are widely available enough that if people are significantly worried or there's, elderly grandparents in the picture or depending where you work or that sort of thing, sometimes getting a test would be a good idea in that circumstance.
Okay, these were really, really good questions from our viewers and really smart answers. So Dr. Hoda, Dr. Martin, thank you so much for your time. It was really good to talk to you.
Thanks, Andrew.
And hey, we'll be asking your questions about COVID-19 on a regular basis. So I know you've got more questions. Send them in. You can message us directly on Instagram @CBC The National, or you can send us an email at covid@cbc.ca.